A long-term kidney patient who believes there is a potentially fatal fault with her home dialysis equipment says the provider was holding her to ransom by withholding its services after she complained. Simone McMahon says Fresenius Medical Care, the sole provider of home dialysis services in Western Australia, has failed to address her concerns about its equipment, something the company denies. Ms. McMahon, the Western Australia Organ Donation and Transplant Foundation Executive Director and a former Western Australia Young Australian of the Year, was born with one kidney and has been undertaking hemodialysis at home for 6 years with the state government-contracted Fresenius. But the German-based healthcare company this year made a change to the single-use blood lines they provide, and Ms. McMahon said she soon noticed they were prone to kinking. She said that could be extremely dangerous because the tubing carried a patient's blood from their body through the machine, and if it were to split, a patient could quickly bleed to death. Ms. McMahon said she asked Fresenius to investigate, and they produced a report showing they had dealt with another matter she raised, but said they failed to adequately investigate the new tubing. She said she wrote to the company stating that if anything were to happen to her as a result of any faulty products, it would be held liable. Ms. McMahon said not long after that, the company stopped delivering her the supplies needed for home dialysis, despite contrary advice from her doctors. It basically reflects that a patient in Western Australia can't express any concerns about a form of treatment or a product because then they are going to be stripped of their access to treatment, which I think in itself is completely wrong, she said. It's like an intimidation tactic for patients to avoid expressing their concerns. In a statement, a Fresenius spokeswoman said the company had been unable to verify whether the blood lines were prone to kinking. Hemodialysis machines filter the blood of a patient whose lack of kidney function otherwise prevents them from doing so, and like most patients, Ms. McMahon relies on using one multiple times a week. Without access to one, patients are forced to spend hours in hospital each time. Ms. McMahon said Fresenius later asked her to visit a clinic so her dialysis technique could be checked, with a warning that her service would be cancelled if the technique was incorrect. She said she had concerns about the integrity of such a test and asked if she could take it on her home machine, with an independent medical professional present. Fresenius eventually agreed to the conditions, but a date for the test has not been confirmed. Meanwhile, during this period, Ms. McMahon said the company limited her to 1 week's supply of dialysis equipment, and she was set to run out of supplies by the end of the week. She said with only one company contracted by the government to provide home dialysis, patients like her were left with no choice. You're put into a situation where if you want home dialysis, accept Fresenius or don't have home dialysis. A Fresenius spokeswoman denied many of the claims made by Ms. McMahon.